On Health Matters Television for Life, a very special half hour at Sacred Heart Children's Hospital. From the emergency department to the NICU, we take you inside this premier medical center. Hear from a mother whose little one received care in the newborn intensive care unit. We'll talk with a pediatric cardiologist and spend the day with some child life specialists who are making the hospital a little less scary for kids. It's medicine from a pediatric perspective on Health Matters.
Health Matters is made possible with the support of Washington State University Health Sciences, Spokane, and Providence Healthcare.
With every twist and shout, and every mended heart, we see you. You who trusts us to take care. Providence, health for all, care for you.
Welcome to this special edition of Health Matters. I'm Teresa Lukens. We're at Sacred Heart Children's Hospital for a rare inside look at this amazing medical center. We begin with a bit of background. Sacred Heart Children's Hospital is the region's only full-service children's hospital serving families in Washington, North Idaho, and Montana. Doctors here treat 5,500 children every year, with a staff that includes 120 specialists and advanced level providers. For many families, their first visit to Children's Hospital starts here in the emergency department. When they arrive, they're met by a specially trained medical team. In fact, this ER is the only pediatric emergency and trauma center in the region. Here to tell us more is Dr. Preeti LaSalle. Dr. LaSalle, thank you for being here. What makes Children's Hospital Emergency and Trauma so unique?
Well, first off, Sacred Heart Children's Hospital is really the only dedicated children's hospital in the greater Spokane area. We serve this side of the state of Washington as well as northern Idaho and Montana. Specifically here in the emergency room, what separates us is the fact that we are really our own entity from the adult ER. We have our own space, so what families can expect from walking into that front door is they get set into the pediatric waiting room, which is separate than the adult waiting room. It's meant really to be comforting to the families and to the children. There's fish tanks that are meant to be kind of a nice added touch for the kids, as well as puzzles and games and TVs that are playing usually kid-friendly movies. So right from the start, it's kind of a nice space for the kids to feel a little bit more comfortable. Obviously, it's not their best day ever being in the emergency room, but things like that kind of set us apart from the adult waiting room. And then obviously coming back into the emergency room, they're met with a really dedicated team of providers, nurses, our techs, everybody who is really pediatric trained. So they're very comfortable in managing what the kids come in with, what they need to be treated with. Hopefully everyone's kind of more comfortable with kids in general and putting them at ease.
Mm-hmm. What about the equipment? Is it different as well?
There's definitely more, it's more kid-centered, so we do have a lot more tools at our disposal to help kids, one, feel more comfortable. We have specialists in the emergency room, like child life specialists, who really have tools to help kids kind of feel more comfortable again. They have distractions and games and puzzles and things like that to make them feel a little bit more ease. Obviously, being a pediatric emergency room, we have kid-specific tools that we need in order to be able to treat these children that are different than what adults would use.
And are mom and dad allowed to be a little more part of the process than, say, in an adult emergency room?
They definitely are. We are very family-centered, family-oriented. We're treating the kids, but it's also kind of a family affair. I mean, we're talking to the family. We're hopefully a little bit more informative to the parents of the kids, as well as the kids if they're age appropriate. But definitely, I think it's a very family-centered emergency room.
When you are trained in pediatrics, especially for emergency rooms and trauma, is there a special language that you use with kids to make them more a part of the process?
Yeah, I think so. I think with any program that is kid-related, especially pediatric residencies and nursing programs and things like that, you get very comfortable in talking to the different ages, and you take into account their development, because that's very, very important in how you approach them and talk to them. So a lot of us are very comfortable let's say getting on our knees or getting to their level, being able to talk to them in an age-specific manner, I think is very, very important. And that's also what helps us differentiate from adults, because we really do have to take that into account. You're going to talk to a 2-year-old differently than you're going to talk to a 17-year-old, and that's all kind of inclusive in what we do.
What about managing pain for kids? Because Sacred Heart Children's Hospital takes special care to make sure that kids aren't hurting.
Right, and being that they are kids, it's very hard for them to tell us, exactly what hurts and what they need. And so that is very, very important to us in managing pain. So we have different scales that we use, from faces to actually asking them and rating it from a scale of 0 to 10. And really, it's just what you're visualizing, because kids do respond differently to pain than adults do. And kind of knowing that that's there and being able to treat that pain is very important to us. So we do try right off the bat as soon as they walk in, especially for things like fractured bones or traumas and things like that, that we really do take pain into account and try to manage that pretty quickly.
So depending on what a child needs, is it all here?
We pretty much have every subspecialty that we need here at Sacred Heart Children's Hospital, which also helps differentiate us from other programs in the area, because we've got all our subspecialists, that we need to consult here in the emergency room to be able to help us manage these kids without having to send them, let's say, to Seattle or to other children's hospitals. So, we run from peds GI to cardiology to neurosurgery and things like that, that we really can manage pretty well here.
So once they're brought here, they can get all the care they need?
For the most part, yes.
All right. Dr. LaSalle, thank you so much for taking us inside the emergency and trauma department.
Yes, thank you.
Spending time in a hospital can be a bit overwhelming, even scary for an adult. So imagine what it's like for a child. That's where a child life specialist comes in. They help families and young patients during their stay here, making life at the hospital as normal as possible. We got a chance to catch up with 2 child life specialists and see them in action.
I'm from Child Life. How are you?
Good.
Good. You having a good day?
No.
No? Do you want a warm blanket?
No.
No, you're warm enough? Do you want to watch a cartoon?
No.
No? You're comfy? Okay. What else are you going to do later today, do you think?
Go to school.
Go to school? You'll feel good enough to go to school?
Mm-hmm.
Oh, I'm so glad. All right. Well, if you need anything, let us know, okay?
Do you know how long the test is going to be until it comes back, or how?
Usually our tests take about 30 to 45 minutes, kind of depending on,
I think that's what they said.
yeah, 30 to 45. Give you a range because I'm never exactly sure.
Lea Thompson is a child life specialist here at Sacred Heart Children's Hospital. Thank you for being here.
Of course, thanks for having me.
Talk about what it means to be a child life specialist.
Yeah, so as a child life specialist, our job is to work with the psychosocial and emotional aspects of hospitalized patients. So we do a lot of coping, procedural support and preparation, diagnosis education, just being an advocate for the patient and their family while they're here at the hospital.
So does that start the minute they walk in the doors?
It does. We have specialists in the pediatric emergency room, in our pediatric surgery center, in the general pediatric floor, the peds intensive care unit, peds oncology, outpatient peds oncology, and then we have a specialist who works with NICU patients and children of adult patients as well.
So it's a real team approach.
It is, yep. We all work together, we collaborate daily, we have a team huddle, we just communicate with each other and do a lot of passing off of patient reports to make sure that we are all meeting the needs of patients no matter where they are in the hospital.
Sort of walk us through the day, a typical day for you.
So for me personally, I'm on the Peds Outpatient Oncology Clinic. So our patients are coming in for appointments. They usually have a lab and an exam with one of our doctors. And from there, they'll either get admitted or they get to go home. But my day is spent doing distraction, procedural support, just general check-ins to make sure patients are doing well at home and kind of how they're processing and progressing throughout their diagnosis.
So what are some of the tools that you use to do that, to communicate with kids?
We do a lot of play is kind of our main thing. So whether it's medical play, making them more comfortable with whatever kind of line they have or whatever procedure they might experience. It might just be play in one of our many playrooms we have at the hospital. It could just be an art activity, utilizing some of our additional co-workers who are part of our art team. We also have programs like our Beads of Courage program that'll help encourage patients as they go along their journeys. They get a bead for every aspect of their hospitalization, whether it's a poke, whether it's a procedure, they might be sedated. It could just be an overnight stay. All of those earn them a bead. And at the end, they have these really long strings that can tell their family members, their friends about their time at the hospital.
Oh, that's awesome. You use music therapy as well?
We do. We have a music therapist in-house, and we also have a few different organizations we partner with. So Songs for Kids is one that we work with, and they come to us every Tuesday, and they go room to room and hang out in our playrooms and common areas and take song requests from patients and families, and just bring so much light to the patients whenever they can sing to them and give them something familiar that they don't always have in the hospital.
So this is unique to a children's hospital, obviously, correct?
For the most part. Yeah. As the profession grows, it's still a newer profession, so as the profession's growing, we see it starting to expand into not only just the freestanding children's hospitals, but also children's hospitals within adult hospitals, and even out into the community, into dental offices, and some people are even opening their own private practices in child life now to accompany people to whatever kind of appointments they might have.
What kind of a difference does it make in a child's care to have a child life specialist along the way?
Yeah, I can only go off of experiences that I've heard from families, but they just have nothing but great things to say about how much it's helped their child, or their child might come to the hospital for the first time screaming or just unsure of what's happening, and we're there to explain things to them in language that they understand, and to be a fun, friendly face that they can see as a supporter and a friend that'll help encourage them to overcome whatever obstacle they might face, and to just be there to advocate for whatever needs we foresee them having while they're with us.
Mm-hmm. Part of your job is sort of making that process normal, if you will. So I know you also plan parties for the kids and special events as well.
We do, yeah. With the holidays, we always have something fun going on. We do random days throughout the year, just those daily holidays, like today's donut day, so we'll bring donuts to the families, or we just recently it was bee day, so we had lots of fun bee crafts. So just fun things to make the hospital a less scary place and to kind of normalize the environment for them, so it's not seen as this awful place where scary things happen, but it's okay, I know I can go there and there's people there who care about me and want to support me and help me out.
Mm-hmm. Do you get kids coming back and wanting to see you even after their treatment?
We do, yeah, they always are. Or if they go to a different unit, they're like, oh, but I want to go back because so-and-so works on this unit and I want to see them because they helped me so much when I was here. And
because it's a fairly new specialty, do you need more child life specialists?
I think as the profession grows, and I think as children's hospitals expand and there's a greater need for certain services, I think we would love to see this hospital have a specialist 24/7 to help the patients who come to the ER at all hours of the day, or patients who might have an unexpected procedure, to be there to support them and help them navigate that uncharted territory.
Is there a typical education path toward this?
Yes and no. I think everyone's journey is a little bit different, but for the most part, we see people who have a child development background, child psychology, anyone who's kind of in that helping field. There are certain classes that are necessary to become certified as a specialist, and you have to complete a practicum and an internship before you can even sit for the exam. So once those coursework classes are completed, then you can become a certified child life specialist. So the whole process can take anywhere from a few years post undergrad, or included in your undergrad with a little extra work.
And a love for kids?
always a love for kids. You have to be a very patient person and someone who is willing to dedicate their time and just has a passion for helping children grow and develop.
Lea, thank you so much for telling us more about being a child life specialist and the work that you do here at Sacred Heart Children's Hospital.
Thank you.
Thank you. Another vital link in providing care here at Children's Hospital is the Neonatal Intensive Care Unit, or the NICU. Every year, more than 800 babies are admitted here. This NICU has the distinction of being the only level 4 NICU in the entire region, treating children with respiratory distress, gastrointestinal and neurological defects and infections. We met one mom whose little one is being treated here. She shares her story.
They checked and I was 5 centimeters dilated, so baby was coming and they couldn't stop it. Hey buddy, can you open your eyes again? Oh, I see you.
After 3 successful pregnancies, Catherine Rank's 4th child did not come easily into the world.
So then they checked to see if the baby was head down so that I could deliver that way, but he was breech.
Less than 6 months into her pregnancy, the staff at Providence Sacred Heart took action that she says saved her life and the life of her son.
They said emergency C-section, and it was just like, whew, just like 100 people doing 100 things to me all at once, whisking me to the OR.
15 weeks premature, little Joshua was born weighing 1 pound 10 ounces. He was taken immediately to the Neonatal Intensive Care Unit at Children's Hospital, where a primary concern was his underdeveloped lungs.
Like I said, he was intubated, so he had a tube down his throat, and he was hooked to a machine that was breathing for him.
Joshua had surgery to close an opening between his heart and lungs. Now 3 months into the NICU, he needs 24-hour attention, which he receives from the same nurses during his entire stay.
We are so thankful. We have 2 day nurses and 2 night nurses who have decided to be our primary nurses. So whenever they are working, they're taking care of Joshua, and that has been amazing. This is how I say thank you to the staff, and I want Joshua to be able to know who helped him get over all these hurdles.
Since his birth, Catherine and her husband have traded off, one being with Joshua while the other attends to their 3 children at home. It's become their new normal.
It took a while. I was very overwhelmed at first.
But a special team in the hospital's Sunflower program has been there with support for the entire family.
Carolyn has been great. She checks in on me like once or twice a week just to see how I'm doing. Then there's Krista. She's a child life specialist, and she's helped my kids relate to Joshua.
For over 3 months, this has been his world. But Joshua now weighs nearly 6 pounds, and he's getting close to the day his family can take him home.
They are saying before Christmas, so I don't know if that's December 24 or December 1, but sometime before Christmas.
The NICU also treats children with congenital heart problems. You might be interested to know that the first pediatric heart surgery was actually performed right here in 1959, and Sacred Heart Children's Hospital continues to be a pioneer in pediatric cardiology. And joining me now is a cardiologist here at Sacred Heart Children's Hospital, Dr. Carl Garabedian. Dr. Garabedian, thank you for being here.
My pleasure.
Talk about the work that you do here at Children's Hospital.
Well, I'm a pediatric cardiologist, and my primary area of focus is doing heart cath procedures on children and babies who have heart conditions. Again, we take care of all children who have all forms of heart disease. They can be as simple as an extra vessel that's still open that every baby has, to more complex diseases where they're born with only half of a heart. Again, I'm the leader of our program, of our department, and I work closely with our cardiac surgical colleagues to have our team function very, very well.
Mm-hmm. So you're saving some of the tiniest babies as well.
Yes, yes.
Yeah.
We're able to now close structures in babies that are as small as 700 grams without even opening up their chest. We can use little small catheters to snake it up through their femoral vein and actually close structures within their heart. That's a brand new procedure we started offering just this year here.
Give us some perspective on the size that you just mentioned. 700 grams, did you say?
It's a little over a pound.
Oh my goodness.
Yeah, It's a little over a pound, so that's not very much.
And then they're able to grow up and for the most part lead normal lives beyond that?
Absolutely, absolutely. They typically get these heart conditions that they have makes their difficult stay within the NICU that much more complicated. So having underlying heart disease plus their prematurity can make it very challenging for them to grow. And so eliminating some of these structures can help them grow and live more normal lives without long-term problems.
How many patients do you typically see in a year?
Well, our program here performs about 150 heart operations on people who have congenital heart defects, and that's defects that you're born with. We do about 150 to 200 heart catheterization procedures also to treat various heart conditions.
And innovation is playing a huge role now in the work that you do.
Absolutely, absolutely. Historically, I'll take an example of a procedure we'll be doing later this week. Babies who are born with a half a heart called hypoplastic left heart syndrome, historically you'd have to perform a very large operation on them in the newborn period, and that has a lot of risks to the patient and their developing brain. We have worked to bring a program here where we can do most of this procedure in the newborn without a heart-lung bypass machine, without stopping the heart, where you can just, with the teamwork of myself and a surgeon, we can palliate or temporize things with stents and little restrictors that we put on the heart. Again, this doesn't fix the heart. It doesn't normalize everything, but it temporizes things so we can do these bigger operations when they're 4 to 6 to 8 months of life. We couldn't do that years back. We didn't have hybrid operating rooms to do heart caths and operations all in the same room. And so this technology has really allowed us to advance and to treat these small babies with these complicated problems.
Is it true as well that you're using some 3D technology, printing technology?
Yeah, absolutely. And 3D technology is fantastic. It really helps us take a complicated problem where we have difficulty wrapping our minds a little bit around how to repair these hearts. And sometimes just having that heart in your hand to be able to look at it, to decide what is that relationship between the aorta, the coronary arteries, and all the different vessels to help plan the operation. A good planned operation is the best kind of operation. You don't want to be planning or making changes on the fly. This 3D technology really just takes the 3D applications we have from MRI and CT scans, and you just take that data set and send it to a printer, and you can print heart models and help you decide what to do.
That's amazing. Are many of these techniques being developed right here at Sacred Heart Children's Hospital?
We aren't developing these procedures here, really. Pediatric cardiology is a very technical field, and there are so many different types of patients with various types of lesions. So it's hard for us to develop certain things because we don't have a million children with this type of single ventricle or that single ventricle. When I use the term single ventricle, there's about 100 different kinds of those things. But we're very aware of the advancements that are out there, and we are very quick at adopting these technologies. The Piccolo device, which is the device now available to close PDAs in children 700 grams or greater, was just available this year, and I jumped right into that to start bringing that technology here locally so patients don't have to travel anywhere.
Oh, that's awesome. And we serve such a wide region too, that making sure that we reach all of those kids or having them brought here is critical.
Absolutely, absolutely. We serve outreach really for our entire area. Here in Spokane, there's no way that we could have the type of children's hospital we have if we were just taking care of the people here in Spokane. We're a regional center. We care for patients from central Washington, northern Idaho, and into Montana with all forms of heart disease and other types of, non-cardiac problems too, but I focus obviously on the cardiac issues themselves there. We know that once we bring these patients here to Spokane, we do their heart surgeries, their repairs, we know that they've got to go back to their communities. And it's important for us to go back to those communities ourselves and continue to care for them there. We have outreach clinics throughout Central Washington, Tri-Cities, Walla Walla, Moses Lake, Northern Idaho, Lewiston, all over, and other clinics within into Montana also. That helps us really continue to care for these patients on the outside.
And using some telecommunication with doctors in those smaller communities as well?
Yes, we do a little bit of telemedicine. What we're really excited to do is to start a new program we call ePatch, okay? And Patch is our program for adults and teens with congenital heart disease, so the Providence Adult and Teen Congenital Heart Disease Program. The reality is there are now more adults than children who have kid heart problems, if that makes sense to you, okay?
It does, yeah.
That's a great problem. That means our children are not surviving and becoming adults. Well, those adults have a whole different type of heart problems that other cardiologists don't typically care for. And so this is a huge aspect of our program that is now continuing to develop. We realize that these people are out in the community, have difficulty coming in as they have families and other things to come to Spokane. And we're using ePatch, which again is telemedicine, where we can come and meet them in their local doctor's offices. That's something we expect to launch in 2020.
What else is next? Anything else exciting on the horizon you can tell us about?
Well, what's next is really trying to focus on not just fixing these kids, but actually helping them live good quality lives. Historically, when my father was a cardiologist, we were so excited these kids survived their operations and they were growing up, and oftentimes they lived sheltered lives, or their parents didn't let them play sports and this or that. And we realized that we had a real negative outcome from those kids having those sort of limited lives, where they became more problematic of what they can or can't do in their head rather than what their heart can do. And so now our big focus is to have these kids have normal lives. Sure, you may have some limitations, but push yourself as hard as you can. Those kids are going to live longer, have less problems, get transplanted less, have less heart failure if we can get them just to get up and move and shake to enjoy our great inland Northwest that we have here.
Thank you so much for being a part of our program.
Yeah, my pleasure. Thanks.
Well, this is the famous fish skywalk. Everywhere you go here at Children's Hospital, you see the attention to detail to make this place just for kids. That commitment is also seen in the hospital's Comfort Promise, which states its pledge to help children be comfortable, secure, calm, cooperative during procedures. And it's also seen in the variety of family support services it offers. Certified music therapists, licensed art therapists, social workers, sibling support specialists, and activities assistants. And along with an army of medical professionals, the hospital is supported by volunteers. If you'd like to learn more about being a volunteer here, we've posted a link on our website, ksps.org. Just click where it says Health Matters. Our special thanks to Sacred Heart Children's Hospital for being such a great host. I'm Teresa Lukens. Until next time, thanks for watching Health Matters.
Health Matters is made possible with the support of Washington State University Health Sciences, Spokane, and Providence Healthcare.
With every twist and shout and uphill battle, we see you, you who trusts us to take care. Providence, health for all, care for you.